Welcome back to Community Health Heroes. Did you know, according to a national poll on children's health, half of parents surveyed said their kids are afraid to go to the doctor. For those aged 2 and 3, 66% feared getting a shot, and 43% were afraid to be examined by a stranger. For kids aged 4 and 5, 89% were afraid to get a shot, and 13% said going to the doctor brought back bad memories of being sick. It's time to start thinking about the new school year, and for many parents, that means an annual checkup for their child. But how can you ease your child's anxiety when going to a back-to-school doctor's visit? Jenni Evans, the Assistant Director and Parent Educator at the Parenting Center at Children's Hospital, is here to tell us how to talk to your kids before they visit their pediatrician and to give us some tips on how to make this annual visit less stressful. Welcome back, Jenni. So great to have you on our show again.
Thank you. It's good to be here.
Of course, today we're talking about kids going to the doctor. What's the best way to prepare kids for this annual doctor's visit?
Talk about it. Mr. Rogers is one of my favorite early childhood sources, and he says if it's mentionable, it's manageable. So be really clear about what you're going to do, about going to the doctor. You can start with your children talking about the waiting room. What did you do last time? Did you read a book? Did you notice something fun on the wall? Was there somebody who works in the office who was fun? So you can talk about that first step. And then go through some of the steps. Help them remember. We go in, we get our height and weight measured. Depending on the age of the child, you can talk about the stethoscope and the otoscope. We get a quick shot, and then we're out of there.
I like it. You snuck that in. Get the quick shot. There's an interesting poll that came out. I'm going to read you some statistics here. According to a recent CS Mott Children's Hospital poll, kids are most stressed about getting a shot, coming into close contact with strangers, and reliving bad memories of being sick. So those seem to be the three biggest stressors. Do you have any tips about tackling those?
I do, and I thought that study was really interesting as well. So when it comes to getting a shot, just like I just slipped it in there, try that. The important thing, just like with dealing with overall anxiety, is to be clear and to be honest. If you know your child's going to get a shot, let them know. If you're not sure if your child's going to get a shot, let them know that, and let them know when you get there, you'll find out. Now, the other two anxiety things I think are a little more interesting. So when it comes to stranger anxiety, certainly it's good to remind your child of somebody they may remember from the last time that you were there. But the fact is that they are kind of strangers. Your child doesn't see them very often. So it's really our role when we do get them to the doctor's office to kind of facilitate those relationships and to stay close. So I think having an expectation like, you remember Dr. Evans, is a little unfair because they may remember them, but they don't have any real reason to have built trust with that person.
I also wanted to ask you about incentives. Now, you don't always want to get into the habit of bribing kids to do stuff, but I think it's probably effective to say, we're going to go to the doctor, then later we're doing this. Is that something you think is okay?
You got it, Leslie. That's perfect. So bribery in general as a part of parenting is a bad trap. But when you use incentives, which is what the word I liked that you used, more as a distraction than as a reward, it can work really well. So the trap that adds more stress to doctor visits or dentist visits or whatever is if you behave, don't cry, act right, whatever, then we get ice cream, then you get to spend the rest of the visit threatening and nagging, and you may not be able to bring them to get ice cream. Instead, if you use it that way and say, I know this is hard, do your best, think about that ice cream, then you get to use it all the way through as a distraction for both of you, right? I can use my own self-talk really well and say, I'm holding this crying, screaming child down, but I'm about to get that yummy lavender swirl or whatever it is. So yeah, I think using that as an incentive instead of a threat, which is what a reward is, it can be really well used.
My last point I wanted to touch on, what do you tell parents about relaxing at these visits? Is there some tips you can throw their way?
So it is important to do the things that you need to do to stay relaxed and stay as aware as you can during those visits. Now, if it's just not working and you're totally faking it, which is also very stressful, then be sure that you do call in advance and say, these are the questions that I'm going to need to have answered. If you leave the visit, this was always the case for me. If I left the visit and got home and thought, I can't believe I didn't ask, you can call. You are the client. You are the customer. And doctors and nurses they're in this for a mission. They want you to get what you need. So call and get your questions answered.
You gave us so much great advice, such a short amount of time. Thank you so much, Jenny.
Sure.
If our viewers out there want to learn more about Children's Hospital, where can they go?
Well, they can check out the Children's Hospital website, and they're always welcome to call us at the Parenting Center for information about parenting and advice on doctor's visits.
Fantastic. Thank you again. So wonderful seeing you.
Thank you, you too.
When we return, how Daughters of Charity Health Center's Care Fellowship Program is providing outreach for more than 11,000 low-income, underserved, and uninsured individuals and families in urban communities throughout New Orleans. We'll be right back.